Welcome to our series on improving your mobility. My name is Ryan DeWitt. I'm a physical therapist and coach here at DeWitt Physical Therapy and CrossFit up in Santa Cruz, California. Today we're going to take a look at your front rack position and see if we can help improve it. Now that front rack is when we hold that barbell across the front of our shoulder, those elbows stay nice and high, and that shoulder's in a little bit of flexion and external rotation. Now, what we're going to primarily address today is going to be a restriction in that front rack due to our upper back and shoulder mobility. Now, it can also be limited because of some wrist and elbow mobility issues, so I'm not going to get into that for this video. But for most people, if we can make a big change in how that upper back straightens up, and if they can get their elbows up and that arm to actually rotate a little bit, that can usually make some pretty big changes. We'll do another video later about the wrist. The tools that we will use today will include a peanut or other mobility tool. I like the peanut just because it doesn't move around very much. We will also use a 1 1/4 inch band and a PVC pipe. So go ahead, follow along, give these a try, and see if they can help your front rack mobility right now. So first we're going to start down on the ground, and we're going to spend a little time working the tricep and this posterior shoulder, and then we'll flip over and do our upper back. I like the peanut. Like I said, it tends to stay put and not move around too much, but whatever mobility ball or tool that you have, we can probably use. So the first thing I'm going to do is get after this tricep tissue here. So I'm going to place this peanut down on the ground. I'm going to lie down on my stomach, and in order to get in a good front rack position, that elbow needs to be forward and our arm kind of actually rotated out. So why don't we mobilize in that same position? So I'm going to place my tricep on that peanut, and just with my elbow bent and my hand ideally turned out just a little bit, and see if I can work through that tissue. Right now I'm just kind of going through that distal tricep, and in a second I'll start working it up there a little further. You can go to the outside of the tricep, inside the tricep. You can start moving some of this stuff and just see if we can get into different parts and see how it feels. You can bend and extend while you're putting some pressure through that mobility tool. And I'm going to work all the way up into that upper armpit area if I can. Makes me turn my back just a little bit to you. And why don't we try that for about a minute on each side. If you can get through here and kind of back here, that's going to be great. Next, we're going to use this for our upper back. So I'm going to place this down on the ground. Let's spin around now. And I'm going to place that ball kind of right between my shoulder blades, even on the lower side. Put one hand behind my head just to kind of protect my neck. And the other hand is going to come across my shoulder and my chest. I'm actually going to grab that opposite shoulder blade if I can. And this is going to pull my shoulder blades around, which are going to help get them out of the way, so this can be a little bit more effective. The basic thing that I'm going to do is just stay in a little bit of a crunch, do a little bit of a crunch, just come off the ball, stay in a crunch, and come back down. Now I can just kind of go up and down just a little bit here, and then if I feel inclined to do so, I can even extend back over that ball. For some people this will be too aggressive, and this would be a great place to start, but ideally, if I can work into that upper back, that's what we're going to try to do. And I can just move it up a little higher. I can even rotate side to side just a little bit to get some of those ribs. You'll find a couple of spots are more stiff and tender than the others. Typically about that apex of the curve, which is just below the shoulder blades, is going to be kind of a real sticky point for some people. And then even as we get up here, kind of in the upper shoulder blade, base of the neck kind of area, it's going to be another one. So what I do is spend maybe like 1 to 2 minutes working through that area, and let's just see if we can prep that tissue and those joints of the upper back so that our next mobilizations are a little bit more effective. So next I'm going to do a banded mobilization known as the super front rack stretch. So I'm going to take my 1 1/4 inch band here, and I'm going to have it anchored to something stable. So this can be around a rig. This is just a door pull on a stable beam. So the first thing I'm going to do is take my involved hand and kind of loop it through. Then I'm going to grab that band in my palm this way. I'm going to wrap my elbow around to the front with that band pulling back and over my shoulder. From here, I'm going to step out until that band wants to pull tight and kind of stretch this tricep. And it's going to press that elbow up. I'm also going to turn my body a little bit and kind of hold my elbow so that it takes that arm into this not just a flexion position, but like I said, we need that little external rotation component as well. So I can kind of lean into it and kind of even move my neck around a little bit. I'm going to try to press that elbow up as I'm trying to pull my ribs down, try to get a little bit of separation through here. Personally, I'm getting a stretch through here. You might feel this in a different place, maybe down at that lat a little bit more. What I don't want is any shoulder pain, so this should not be painful. If it is, it's just too aggressive and we can back off. Or if you're not sure about the positioning, then just either tread very lightly, or why don't you check in with a PT about this. So I'd spend about a minute here or so. I can even, in this position, I can even kind of contract those muscles for a few seconds and then relax and see if I can get a little bit of a deeper stretch. And why don't we try that on both sides. So next we're going to take that PVC pipe that we are all so familiar with, hopefully. And what we're going to do is we're going to hold it in one hand, the target hand, and we're going to hold it like a sword. Then we'll bring it out in front of us and let it fall to the outside, kind of letting loose in the fingertips. Take that opposite hand and grab it underneath. This might be a stretch that you're familiar with, in which we kind of control that elbow position and that angle of rotation. I'm going to pull that elbow up and try to also at the same time kind of pull that hand out just a little bit. Now this is going to pull me into that flexion and externally rotated position that I was talking about, that it usually makes for a nice front rack position. However, when I do this standing, sometimes we'll get people that have all the range of motion in the world here, so this looks pretty good. But as soon as they go to squat, it just pulls their elbows down because the lat gets pulled taut down and across this hip and it pulls those elbows down. So what I'm going to ask is, in that same position, can you lock that elbow up, squat down into your depth, maintain that position, pause for a breath or two, and come on back up. Go ahead and try that 10 times on each side. Okay, so now that we have prepped the tissues, stretched the joint out a little bit, and kind of integrated it into a larger movement pattern that simulates that front rack, let's see if we made a difference. So go ahead and you can grab your barbell, we'll bring it up into that front rack, let it fall back into those fingers. And what I want are, ideally, those hands would be slightly outside those elbows, and I want to make sure that you can press those elbows straight ahead so that upper arm is parallel to the ground. Those elbows are pointing at the wall in front of you. Go ahead and get in your squat stance. I'm going to have you just sit back, press those up, and see if you can press those elbows up as you squat down. Now I want to make sure, as much as possible, that we are now being super active in this position and pressing those elbows forward. Now you can think up, but I'd rather you think pressing forward. And can you keep those elbows pointed forward as you squat down to the depth of your squat? Maintain that position, pause for a few seconds here at the bottom, and drive back up out of those heels. We want to make sure that, again, if I'm here, this is horizontal. As I squat and those lats really want to pull me down, we've worked on that, so now we need that serratus anterior to really kick in and keep that elbow pressed forward. Before, it might have been pushing against too many tissue restrictions. Now is a chance to reload those muscles and make sure that they're doing the right thing. So give this series a try, integrate it back into your barbell positioning, and let's see if it makes a difference.